What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. In today's video, we are covering the difference between the online radiologist versus the in-house radiologist. So to give you context, I work at a trauma 3 ER night shift. Been doing it for about 4 years, and with my hospital, because we are at a trauma 3 and we don't have the radiologist in-house, they think they leave like around 6 or 5, I can't remember. So typically I deal with the online radiologist in the daytime deals, but I've worked an ungodly amount of overtime in both teams that I hear and both understand both worlds. So for the most part, the biggest difference is the in-house radiologist deal with all the fluoroscopy in the house. And for the most part, maybe it's just our radiologists, they're a little bit more picky. They're basically more picky compared to the online radiologist. You will deal with them as far as like if stuff doesn't get sent right, or it wasn't post-processed correctly, or you have technical problems or report or stuff, then you may interact a lot. But most of the time you'll put it online, they'll read it. Sometimes the report comes back and maybe the nurse or the doctor be like, I don't like this, I'm gonna need to get one of our in-house radiologists to double check, to double look. So sometimes you'll deal with that. Now, overnight at our place, we typically don't do any fluoro unless it's like some emergency stuff. For the most part, you have a certain amount, like certain radiologists, some of them will have that there were certain days they'll be on call, so you can call them in. There's like a whole process, because majority of the times the in-house radiologist does not want to come in until the morning, so they'll try to push it or persuade them to do other things so they don't have to come in. Maybe that's our radiologists and how they are. But I've noticed that the radiologists, compared to other doctors, hold, at least at our hospital, hold some level of like, it seems like power compared to, because like other doctors, you can have another doctor reach out to them and be like, hey, we got this and that. And they'll be like, okay, we'll take care of it. What's that? Whatever, right? And then with the radiologist, it's like they're hidden away on the computer. And then most of the doctors don't like, at least in the emergency room, don't like to talk with them a lot. And they'd be like, hey, can you reach out to the rad? Or hey, can you like even when they try to talk to them, and I've witnessed it, a majority of the times, whatever's going on, they'll get like shut down, and the rad will be like, we'll do it in the morning. A majority of the times, unless like it's a true life or death, something serious, majority of the times that's what happened. And every single time I'll see them, and they'll get disappointed that they weren't able to convince them, and I'm like, I don't know what to do. So yeah, depending, like I don't have the best relationship with our radiologist in-house because I just never see them as much as the daytime. Certain radiologists are like pretty chill. They're like very well versed. If you ask them questions about like why we do this or why certain stuff, like they're more than happy to educate you, because like at the end of the day, if they can explain why they need something a certain way, and we who take the pictures for them give them better images, they can maybe do their job easier, be able to see certain stuff better. Like it works out perfectly, you know. Now sometimes the in-house radiologists are, maybe something's going on or they're having a bad day. You can get, like, if you take not the best images and maybe you didn't put proper notes, they will probably call you and chew you out. There's been a few times where certain texts got chewed out because maybe it's not hanged correctly. Like, a majority of the time it's kind of like petty stuff, but they make a big deal out of it. And sometimes it is serious. Like sometimes it's like, yo, you shot the wrong patient. Yo, like there's something serious of why maybe the images wasn't completely optimal, or like there's something serious like going on. So sometimes it's understandable. Other times they're just being mean. So you have to sometimes have thick skin with certain in-house radiologists. For the most part, as long as you put good notes, and if something happened, you document it, because they just read. Because at the end of the day, the radiologist does not know what it took for you to get that image. They just saw the picture. And then your little notes, that's all they have to base off. Because sometimes certain patients are competitive or certain patients aren't optimal. They don't know that. So it's up to us to be like, this is the best image I could do. Here's why I couldn't get better or something. Majority of the times I've noticed if something's like completely broken and is very bad and you weren't able to get optimal images, as long as you take several pictures when you document it, you should be fine. So yeah. It's been your boy Miguel. See you on the next one.